Losing weight before surgery. Losing weight before surgery can make a huge difference. I'm Hamza Aziz, creator and producer of the Talking with Docs podcast. Now we're bringing deeper insights here. Let's talk about why weight loss matters before surgery.
Okay, today 2 doctors are going to share their experience on how their patients lost weight before surgery.
Which doctors?
You and me.
Right, yes,
Two of
of
us.
course, yes.
Two
yes,
of us.
us. So we counsel people all the time. I'm Dr. Paul Zalzo.
I'm Dr. Brad Weening. Welcome to Talking with Docs.
We counsel people all the time on how to lose weight because they come in our office with musculoskeletal complaints, usually lower extremity. And one of the ways to manage your musculoskeletal lower extremity pain is with weight reduction.
Right.
So we are often, every single day, talking to people about how they can lose weight or what are they doing to lose weight.
Yeah.
All right. And we keep track, kind of. We ask them again when we see them 6 months later, 3 months later, a year later. How did you do it? What did you do?
It's hard. And I'd say, unfortunately, the vast majority of people are not super successful. That extends to the rest of life, too, not just arthritic patients. This is life.
It's hard, but it's
hard.
not impossible.
Not
we
impossible.
do see success stories.
Yes.
We really do in our office see success stories.
And I think one of the things for us is that I tell my patients, listen, it doesn't matter if you lose 100 pounds, you're still going to have arthritis.
Yes.
And you still might have pain because it does not grow new cartilage by losing weight. But it's like wearing a knapsack. I use this analogy all the time that you never, ever get to take off that's full of a bunch of, say, pounds of butter or weights from the gym or whatever.
Yeah.
When you take it off, it feels good. So your symptoms are going to get better. But for this scenario, we're talking about, why does it matter to lose weight before surgery? Why does it just do my surgery, doc? I just want surgery.
Well, because if you're carrying too much weight before surgery, you increase the risk of complications
During
surgery, during,
after. Yep.
And the surgery is more challenging, technically challenging, so it's kind of self-preservation.
Your recovery is harder.
Recovery's harder. It's just better.
I also think your outcome ultimately might be reduced. Like your ceiling of your potential benefit, I think, is reduced by carrying extra weight too.
Certainly, there's some evidence to suggest that the longevity of the artificial joint we put in you is decreased with this. Right?
Agreed.
Anyways,
lots of good reasons.
Reduce it before surgery. Reduce it so you don't need surgery.
Sure.
Because sometimes I've had patients come in, I lost 80 pounds.
I've had that too.
And I don't, okay, I'm like, we'll cancel your surgery. We don't need to replace your knee now. You feel so good.
Not to mention the general health benefits, obviously.
Oh, the general health benefits.
That's very dramatic.
Was it?
That was very dramatic. Oh, that's good. Okay, so we're going to go through the top 5. This is not a scientific study. This is as our literally probably between the two of us, certainly over 10,000 patients, maybe closer to 20,000 patients.
By years. Between the two of us, probably 40 years worth of seeing people.
Yeah.
And how they lose weight.
Yes.
Talking about losing weight and what did they do and what should they try.
Okay, so let's go with number 5.
Okay, so we're gonna save the ones that are most effective to the end.
Okay, so we're going from the worst choice to the best choice, or the less successful to the most successful.
Like people have had success, but not as many people have had success with number 5 as they had with number 1.
Okay, number 5.
Number 5 is exercise. People say, I started exercising, I started going to the pool, I started doing this and that.
Okay.
It works,
okay? Sure.
It's not as effective as the 4 you're about to hear.
Right.
In my experience, in the office, some people have had success with that.
Totally agree.
Just exercise.
A little difficult sometimes. People are like, really? I got sore hips and knees. I can't do it. We have another video that talks about things that you can do, even modifications you can make actually in order to be active. Just try to get essentially your daily caloric expenditure from exercise higher than it was before.
Yes. But what I've learned from all these patients over all these years, exercise alone as your weight loss strategy, while it's really good for you, I think exercise of all the pillars of health is probably the most important personally.
Yeah.
In terms of the scale, pounds on the scale or kilograms on the balance, the least effective.
Okay, so that leads into my number 4. I'm going to give you 2 phrases that you can remember. 1, you can't outrun a bad diet.
Okay.
Kind of leads into your exercise kind of thing. And the other one is abs are made in the kitchen.
Oh.
Not the gym.
Really?
Yes. So, we all have abs.
We do.
We all have washboard stomachs. It's just how much laundry is on the washboard, right? And one of the ways, so number 4, is a healthy diet.
Very wise, sensei.
There you go. So a healthy diet, what does that mean? Obviously, it can mean a bunch of different things. It does not mean adhering to a specific diet, whether it's keto or Atkins or intermittent fasting or plant-based or whatever. It means eating more healthy choices, so more whole foods, more real foods, less processed food, but also getting rid of the junk. So getting rid of the sugar, getting rid of the alcohol probably, or drastically reducing the alcohol, things that are extra calories that are not really adding to your health.
Okay. Yeah, and I the way I say it is, You don't need to go on a diet, but you need to have a good diet.
I like that.
So that's how.
That's number 4.
And I think that, and I have had patients do that too.
Yeah.
How did you lose your weight? I just changed what I eat.
Yes.
Okay.
Yep.
And I think that's a good one.
Yep.
Okay. The third one that I see patients do that I find most effective is not necessarily focusing on changing what they eat. I've had patients just say,
Yes.
I just reduced what I eat.
Right.
Calorie reduction. You
Yeah.
may not still have the best diet, but
Yeah.
they just reduced it. I cut it in half. You know what I mean?
And I think what the science would show is that reducing your calories from eating way too much to a normal amount versus a normal amount to a really super restrictive amount, the benefit is probably the tons of
Yes.
calories to the normal amount, because our bodies are very efficient and they get
Yeah.
used to less calories. So people that historically have gone on very restrictive diets, it's actually very hard to do. And your body adjusts and
Yes.
starts to, unfortunately, waste muscle and a bunch of other negative things. So yeah, getting down to like a more normal caloric intake, which we've talked in other videos about, most people underestimate how many calories they're actually doing. So one way to do this is like keeping a journal, keeping track of your calories. And then they go, wow, you know what, I thought I ate 200 calories, and when I did the math here, it was 3,100, and
Yes.
that sneaks up on you pretty quickly.
The laws of diminishing returns. That
Yes.
Going from too much to the right amount is much better than going from the right amount to not too
Yes.
too low. So
Okay.
that's it. So we had exercise, we had changing what I eat, we
Yep.
had reducing what I eat. These are things that we hear our patients telling us.
Yep.
We haven't done a randomized controlled trial,
Nope.
but this is just our experience hearing patients tell us.
But a lot of trials have shown that the next two things are
boy.
certainly superior to
Yes.
diet and exercise. And a lot of people, I think, that are not trying to lose weight are very judgmental on these next two.
They are. I wouldn't use the word superior because what is superior?
I think the evidence
But
shows that
I
they are
would
more
say-
effective at causing.
Yes, I
that
would
makes
say-
them superior to me.
Not to me. There are superior. I don't think that makes them superior, but they're more effective.
They lose more weight.
Yeah.
So if you rank them like this,
Yeah.
is one above or below?
Well, I don't say it's better.
It is
but
better though.
No, it just reduces more weight, but overall better for your health or better for you.
What? I think weight loss experts would disagree.
Well,
with
let's
you.
tell you. You tell us what you think. Is this
Okay.
superior or just more effective at losing weight?
Okay.
The next one is some kind of bariatric surgery.
Yes.
Whether that's some kind of stomach reduction, banding, stapling, all the different bariatric surgical
Yes.
options that are out there.
Sleeves.
This is what I have seen to be quite effective
Yes.
at having patients lose weight. I don't tell them, I don't prescribe it.
Yeah.
I suggest these are the options, but people who have gone on and done that and come back a year later
Yeah.
have lost weight.
And most studies show you can lose up to like 30% of your body weight.
Yes.
Yeah.
Yeah. Whether or not it's better for you than the other things,
Yes.
I'm not
No,
saying.
it's just better at losing weight.
Yes.
Yes.
And I mean, it's invasive.
Yes, it has risk.
It has risk. and
Changes your lifestyle afterwards.
It's expensive
Yeah.
too, because I know around here it's not always covered
Right.
by the government-funded healthcare service.
And
Sometimes it is
accessibility, right?
funded
Could be
by-
years to wait here. It's complicated for sure.
Yeah, but in terms of bringing pounds off, that
Yeah.
seems to work.
And then our number one, and this has been over the last kind of couple of years.
I would say 3 years.
Yeah. And I'd say it's, I start to ask the question now, rather than them sharing how they lost weight, I'm like, hey,
Was it?
yeah. And
Guess what it is before
Yeah.
we tell you.
Okay, we'll
Put a
give you-
comment, give a guess now.
Give me a
Put your
second.
guess in now.
So it is the GLP-1 class of medication.
GLP-1. And the most common one you've heard of is Ozempic.
Yeah.
There are many other.
Semaglutide, Wegovy, there's a whole bunch of them.
a lot of them.
Mounjaro, and they are very effective. Same thing, their target's about 20% body
Yeah.
weight typically is what people can lose. Obviously, everybody's different. I have patients who have been on it, lost a little bit of weight and then it stopped, or had some of the side effects that were more prominent in them, so they couldn't take it. So I think what we're learning too about these medications is it's not just about your weight, but it's beneficial for your heart, maybe for your kidneys, maybe for some addictive behaviors. Like it's a rapidly expanding field of medicine that has got a lot of people really excited. And for us, we've seen a lot of success both before and after surgery with patients being able to lose a large amount of weight.
Bear in mind, these are relatively new.
Yep.
And so there will be side effects. There are side
Yes.
effects to these medications. There are complications, and we'll be learning more about them over the years to come about the long-term implications of being on these medications
Yep.
and complications. So I'm not saying it's right. I'm not saying it's wrong.
Right.
I'm not going to write a song, but I'm just saying that most of my patients
Yes.
now that have lost weight, that is the number one way that they've done it. So if someone comes in, like you said, and they've lost weight, and you had to guess, play the odds, and take a gamble, say, how'd you do it? taking one of those medications.
Right, because historically diet and exercise hasn't worked. I mean, we knew this for a long period of time,
Yeah.
and for
It
the
works for
average
some people.
for the average person, it just doesn't work very well. That's why we have a weight problem.
Yeah.
Yeah. But this has allowed people to kind of get that jump start, and then potentially alter other behaviors in their life. But it's not just about people making bad food choices. People have metabolic conditions that are causing them to not be able to lose weight, right?
Or not only metabolic, there's psychological aspects
Host
to
reasons.
this. It's such a complicated issue.
We're learning it's much more than just a choice. It's not a choice. Like people are not choosing to not lose weight.
It's something that you're living with.
Yes.
And we're not saying we advocate any one of these 5 things. We're just reporting what we have heard our patients say over the last combined 40 years of talking to patients challenged with this, struggling with this, and these are the things that seem to be working and sort of in that frequency.
And we thought it was worth sharing because then this way you could talk with your healthcare practitioner and say, hey, I've tried this and this. Maybe I want to have a discussion about this or this or this.
Those are the things. And I'm sure there's other things too.
For sure.
Leave a comment if you've tried something and had no success, or you've done something and had lots of success.
Yep.
Because I guarantee you there'll be someone out there who will be looking through the comments and will get some benefit from it.
Yes.
From having someone who went through it themselves rather than listening to us yammer about it.
Okay, I like it. If you like this video, please like it, subscribe to our channel, share it with someone that you know is maybe trying to lose some weight. Check out our podcast that we just launched on Spotify. It's coming soon to Apple.
Oh, yeah.
Oh, yeah.
So you don't have to look at us.
That's
You
right.
just listen to us.
Just listen.
You are in charge of your own health.
We'll see you next time.